how do you expect a doctor to be your advocate? Okay. Now, doctors have different level of responsibilities. A primary care doctor, there's a specialist, and then specialists are divided into surgeon or non-surgical. And then there's also a group of ancillary healthcare people like physical therapy, physical rehab, and for psychology, and all kinds of a group of people down here that most of us don't mention. Home care, all right, and retirement home, skilled nursing home. All those are huge, all right. So when you look at a doctor, you say, well, can this doctor take care of me all the way through? Okay. Now, meaning from the time you see this doctor to when you get sick, and after you get sick, what happens? Okay? And after you recover, what happens? When you get sent to a specialist, for instance, they do only specific things that pertains to why you see him or her. You are referred to see the specialist for either your bones, whether it's your brain or your eye, ear, nose, and throat, or your heart, specialist, okay? But primary care, your generalists have to take care of all those things to find out they are in working order. He or she in primary care this day and age, unless they're a family doctor like myself, we are trained to do deliveries also. But in San Francisco, of course, there's so many obstetricians. There's no room for a family doctor to do deliveries because they are the one that we refer out to. Okay, so but we are knowledgeable in how to manage a pregnant lady and what to expect during pregnancy, before, during, and after. Okay, so but even though our knowledge is not called into play. Okay, so now how do you advocate for a patient? Let's say there is a cancer that the primary care physician found, and that is a prostate problem, okay, or a heart problem, and it requires a specialist to take care of, all right? But then the specialist that you prefer or the primary care prefer is not available because he or she is so popular. It will take you 3 months to get in. Now, that certainly is a disadvantage, all right? So 3 months to get in, what is going to happen in the interim, right? So are you just going to wait for the cancer to develop before you go? Or if you have a heart problem, you just suffer possibly a heart attack, or something bad, that can happen while waiting. Of course not, So this is where your primary care comes in. Advocates on your behalf, and he or she may be able to just call up his or her friend as a specialist and say, hey, gee, I'm Dr. Sue, this is my patient. We appreciate that the condition is such and such that the patient needs to be seen right away and not wait 3 months or even 2 weeks. So being an advocate, will the doctor do it for you, is very, very important. All right. Now all these things are done non-paid by the doctor in his or her office on your behalf that you don't even know. All right. And it's unfortunate that some doctors are overwhelmed because they're so inundated with patients that they don't have time to do things like this. They'll probably just ask their front desk officer, okay, when you get a chance, can you call so-and-so office and see if they can accommodate this patient who is having problems. And if your front desk is very inundated with things like copying things, insurance problems, billing, all those other things that part of in practice, they may forget, not because they want to, because they just don't have time. Then that falls through the crack. Okay, so this is something that's important that I think have your doctor being your advocate is important. Now there are big institutions that even a doctor cannot do anything for you. Let's say you have a brain tumor, and the university center around you, they're the best in the area. They are the top 10, top 20 hospitals in this specialty in the United States and worldwide. Of course, as a consumer, you say, well, that's the hospital I want to be to operate on my brain tumor. But then you can't get an appointment because when you call that university, you're always on waiting, or you're on the wait list. And they don't see you, they can't even make an appointment for you. So what do? So you call back your primary care and say, oh, I couldn't get an appointment, can you help me? Now that's when the doctor's office comes in as your advocate. Now this is after seeing you as a patient now, right? So all this work, you have to rely on that doctor's office to help you out. Now if you go to a doctor that has 5,000 patients, let's say, on average a doctor has 1,500, 2,000 patients. And this doctor has 5,000 patients or more. Now, do you think he or she will be able to help you with this kind of detail? I don't think so. Not unless you're his best friend or her best friend, okay? But if you're just an old Joe off the street, I don't think you're going to get far with that office, okay? Just to let you know that, selection is very important. And whether it works for you or not, I think it really depends on your personal relationship with the doctor.